Now, your health, your safety. This is ABC7 News.
I'm Kristen Z. Welcome to not our show, but your show. We say that because every day at 3 p.m., you'll get a chance to ask questions to experts and watch them answer them in real time. You can do that by participating in our live stream on Facebook Live or YouTube Live right now. We're also on ABC7news.com and on our app. Today, we're taking questions about Bay Area stay-at-home restrictions, like what can you do, what can't you do now, what does that mean now that the shelter-in-place has been extended? So post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. Or just say hello and leave a comment. Now, remember, we don't take breaks on live streams, so you'll get extra content and more answers if you join us on our live streams during our commercial break on air. But today, before we get to your questions, I want to start with a very special local story. You know there are Bay Area healthcare workers on the front lines. So today we have a Bay Area doctor and Navy reservist who's serving on board the Mercy right now. That is a huge Navy floating hospital that we've told you about, now docked at the Port of Los Angeles to help in the battle against the coronavirus. So there you see Commander Marin Wong joining us from the Mercy. Honored to have you with us. Hi, Commander Wong. Can you hear me?
Hey, Kristen, how are you doing?
Hey, I'm doing just great. Is it salute? Is it ahoy? What is the proper greeting for you?
Just about anything's fine.
Anything's fine. Okay, you're easy. That's good to hear. Commander Wong, how long have you been in Los Angeles now at the port? How's it going?
I'm sorry, it's quite loud here.
Oh, I know. You guys have a lot of stuff going on, but how long have you been in Los Angeles now? And so far, how's it going?
So we got here on Friday, so we've been here about 5 days now. And things have been going, according to plan. We got here right on schedule. We set up the hospital en route here from San Diego and ready to receive patients on Saturday. And we're starting to take patients on board and starting to get busy.
Yeah, so tell me about those patients. And I'm looking at a picture, I think, of some of the patient ward with the beds available. But has the volume been fairly light so far? And also, they're not the COVID-19 patients, right?
Right. We're not taking, the plan is not to take COVID-19 patients on board. We're here to decompress the healthcare system in the Los Angeles area.
How many have you guys seen so far, roughly, patients?
I don't have visibility into that big picture, but just kind of rumor has it that we're in the double digits.
Okay.
And, we're acting slowly. We don't want to overwhelm our own systems first by off more than we feel first.
So before we get into more detail about exactly your mission, let's go back to when you got the call, right, a little over a week ago that you were going to be deployed. Talk about getting that call and all those feelings as you leave your family in San Mateo and your job as an anesthesiologist at Mills Peninsula Hospital behind and just get up and go.
So, I wasn't quite expecting it to happen this way, but I got home from work on Wednesday and heard a rumor that I might be activated. They needed anesthesiologists to be on the Mercy and the Comfort. And by Thursday morning, I had orders. And, it was a mad scramble for a couple of days to get my bags packed and get a lot of business taken care of. I was on a plane on Sunday morning to get down here. We left San Diego on Monday, the day after. And I know a lot of reservists on board, they got even less notice. People got here on 48 hours.
But kind of, what was the feeling? Was it one of being sort of anxious? Was it also, exciting in a way that you're going to be part of a massive effort? What are kind of the emotions that are all broiled in there?
It was, both anxiety and excitement. It's what you train for and what you join the reserves for. You do the reserves and do your weekend a month, 2 weeks training once a year. But the ultimate mission is to deploy and support the community. And I'm thrilled to be able to contribute my skills to this big mission.
All right. Can you walk yourself to a spot with perhaps slightly better signal? I know it's tough on the ship, but maybe you can start to move a little bit towards the edge where you guys have the stronger signal. Just to try to... Yeah, and we're getting a tour of this hallway. Let's see. Just keep going and see where you think if we can get a slightly better signal. I am wondering, the Mercy does have a very interesting story too, right? Wasn't it about to kind of be renovated and sort of be out of commission for a little while when it suddenly had to turn around and do this?
Yeah, that's what the crew of the ship tells us. I mean, I'm not usually assigned to the Mercy, so I don't know the long-term history. But we were told that the ship was getting ready for some major renovations and have some decking repaired. So the operating rooms were stripped of everything. I mean, the cabinets were off the wall. In the few days to go out to sea and do some ship things, me and colleagues were all over the country basically assembled the hospital. We put cabinets up, we tested out equipment, we stocked medication parts with anesthesia, medication equipment, and basically built a full functioning hospital.
All right, Commander Wong, unfortunately, the signal is kind of breaking up, so we're not able to hear you that well. So we have to, so sad for me to cut the conversation short. But I know that, at great sacrifice, a lot of the reservists from around the country and the sailors there, about 1,000 of them joining you there to be prepared to handle whatever that comes, right? So we thank you. We thank you so much for your service. I'm still hanging on to hope that the signal is improving. Do you have a final message for us?
Yeah, Kristen. I mean, this COVID-19 virus. I'm a kind of a science fiction fan, and I kind of see it like in all the science fiction movies. Some alien presence comes down, and all the nations and people of the world unite to fight off the aliens. And, I kind of see COVID-19 the same way. People need to kind of put aside political differences, prejudices, and because the virus doesn't discriminate. It attacks everybody. And we just need to kind of unite as humanity and as a people to fight off this existential threat.
All right, Commander Wong, we were able to hear that message loud and clear. Thank you so much, all of you on board. We appreciate what you're doing. Take good care, okay?
Thank you, Kristen. I'll pass along the word.
Okay, thanks. Earlier, Commander Wong was telling me it is not easy to social distance on board, but they're trying their very best. As you know, it's tight quarters, and they do have 1,000 people, but they're taking every precaution. He says they're fed well. He says that he's met interesting people who all are answering this call to want to help. So we certainly hope that by doing our jobs to shelter in place and social distance religiously, we can keep their jobs a little easier, a little lighter. Like he said, it's kind of a slow start at the moment. Only a handful of patients so far. They're ready to take on more should that surge happen. And you heard Governor Newsom today. They do expect that to happen in the next couple of weeks. So we'll be checking back in with Commander Wong, and I'm Facebooking about his journey. So you'll also want to follow him there as well. Okay, we're going to take a little break on air, but we never take a break on our live stream. That is on Facebook Live, YouTube Live, on our app, or ABC7news.com. We are taking your questions about the stay-at-home orders that have been extended next.
And bring commercial break.
All right. Hi, folks on Facebook. Thank you for joining our live stream today. And during this time, I want to share with you some of the latest numbers that we have about the coronavirus and the number of cases. In the world today, 926,000 cases confirmed. And in the U.S., that figure is 209,000. We have 4,633 deaths in the U.S. And you can see that number grew pretty quickly from yesterday. But the good news is 8,400 people have been confirmed to have recovered from this. And the Dow, meantime, not doing so well. Continued fears around the world sending the Dow down again. As you know, we started this pandemic at around the 30,000 mark. At this point, we are, in the low 20,000s range, and the Dow down 973 points today. And just the latest thing to be canceled worldwide event or international event is the Wimbledon. As you know, the Tokyo Olympics, that had already been postponed till next summer. And now we get word that the venerable Wimbledon, that tradition that hasn't been broken since World War II, is now also just canceled for the year. So that is another sad thing for us to all digest as we continue to grapple with the impact and the changes due to the pandemic. Okay, reminding you that we'll be coming back on air in about 20 seconds, and we'll be talking with Marin County folks in terms of their public health management to see what they are doing and new rules that you might have to follow. And even if you're not in Marin County, not to worry, because the counties work together and share similar rules. So we're coming back. We know you have a lot of questions about the Bay Area stay-at-home orders. San Francisco Mayor London Breeze says they've seen positive signs as the Bay Area shelters in place. Well, let's talk more now about this and get your questions answered. Joining us live is the Public Information Officer from Marin County, Lane Hendricks. How are you doing? Thank you so much for making the time for us.
Thanks for having me on, Kristen. It's really great to join you. You know, we're doing what we can, like the rest of the Bay Area, to adjust to this unprecedented health crisis. As you can see, I normally would be meeting you from our emergency operations center, but even our emergency managers have opted to go virtual. And so what we're doing is trying to be as flexible as we can and practice what we preach in terms of staying at home and physical distancing, like we're asking our residents to do in terms of responding to COVID-19.
Mm-hmm. Let's talk about the situation in Marin County. Your cases, your caseload, and also the number of deaths comparatively low, you know, compared to the rest of the Bay Area. But it has grown in the past few days, and you are concerned. Can you give us a status update?
Absolutely. So we are seeing a significant climb of overall cases. We did surpass that 100 case mark just a couple of days ago, and it was a significant surge. We saw about a 25% jump just 2 days ago, and it continues to climb. And we've experienced 5 COVID-related deaths so far, which any death is really heartbreaking, but we are taking this extremely seriously because all of our deaths so far have been individuals over the age of 60. Mm-hmm. And in Marin County, we have a statistic where we're known as the oldest county in California. And what that means is 1/3 of our population is over the age of 65. So we're already seeing a tremendous effect on our older adults. And so that's why we're taking this very seriously in terms of implementing a really effective strategy in terms of reminding people to stay home, physically distance, and all the other things that the rest of the Bay Area is doing.
Yeah, and like the rest of the Bay Area counties, you guys have extended your shelter in place through May 3rd at least. And along with that, you've gotten a lot more specific about things that you cannot do and places that you cannot go. And so a lot of places are starting to get shut down that are operated by the county. So I'm going to throw some questions at you. Here's one from our viewer who posted on Instagram. They said, there is a dog park within walking distance from where I live. Can I still take my dog there by foot?
So there's a yes and no answer to that. And ultimately the no is dog parks are now closed. Yes, you can take your dog for a walk, but dog parks are closed. And the reason for that is we really wanted to be mindful of those areas that naturally tend to encourage congregation. And while, you know, individuals certainly could argue they can be mindful of that 6-foot physical distancing rule, dog parks are areas that tend to encourage congregation, much like the issue we saw a couple of weeks ago with congregating at the beach. So as a dog owner, I recognize the challenge in that sometimes there's nothing better than being able to take your dog to the dog park and let it run and you get to socialize with neighbors. But for now, the best exercise for both you and your dog is a leashed walk in your neighborhood.
All right. Nicole Malton wants to know, why are there car dealerships that are still open in San Rafael? Is that still considered essential?
Great question. So there is a caveat to that. And I did want to put out for all of your Bay Area viewers that each area is being enforced or patrolled in a slightly different way. So always check with your local jurisdiction. The argument with a car dealer or maybe a car repair shop is that we may need a car, just like a bicycle repair shop. We may need a bicycle in order to complete our essential activities, whether that is going to the grocery store or for essential workers, being able to get to their place of business to perform their essential service. So that is why you're still seeing auto repair shops or car dealerships that are open. Now, you know, I don't know if you want to be purchasing a luxury car during this time. I'll leave that open to somebody's discretion, but that is one reason why you would see those places still open.
Okay, well, that's certainly good advice to check with your local municipality or county. But what about when there's conflict? Because Kathy asks, I own a dog grooming business in Novato. The health department says we are essential, or actually non-essential, pardon me. And the police department says grooming is okay. Who do you believe? I think a lot of people are caught in that.
That is really tricky, and we're working with our local municipalities to try to provide some consistency. By and large, the new order provides a lot of clarity on some essential services where the first order may have provided some gray area. And so we hope that new order does provide the clarity that people are seeking. As far as dog grooming goes, the Marin Public Health Office maintains its stance that it is non-essential.
Okay, real quickly, can you clarify, since the extension of the shelter in place, right? Because before we were looking at April 7th, and now with the counties extending to May 7th and the latest issue, and it's made it a lot more clear, what are the big changes? Like, what are the big things that maybe under the previous order were still allowed and now are not?
So we've already talked about a couple of them. I mean, some of those outdoor areas that encourage congregation, such as basketball courts, golf courses. We already talked about dog parks. Many of those are now closed, and those are off limits. Now, that being said, if a family or a household unit wishes to play basketball in their backyard, we can't stop them from doing that. And the idea there is if they're playing as a unit, that is deemed safer because they're passing the balls among peers that they're likely already, I don't want to say spreading germs to each other, but in a household unit and a family, it's a little different than playing pickup basketball at the park. So there are some of those activities that are no longer allowed, some of those areas that are no longer open. A big change between the first order and the second is really around requirements on some of those essential services. Most importantly, in that the physical distancing, commonly referred to as social distancing, that effort to keep 6 feet between you and another person, is now mandatory. And many businesses, including grocery stores, are being asked to come up with some sort of protocol to which they can make sure that they can ensure social distancing, not only while people are within their establishments, but while they're waiting in line to check out and that sort of thing. So that is definitely something that is new. There's some clarified language around construction, which is really important to provide as well, in terms of what is deemed essential versus not. And really it comes down to those things that are affordable housing projects, those things that are deemed, let's see, what's the word? Government related essential services. So if, it's deemed essential, we need to make a road repair, something like that. Those are allowed to continue. If it's an emergency repair to a house, of course, that is certainly allowed so that people can maintain the safety within their home. Affordable housing projects may go forward. Shelter and temporary housing projects also are included with that. But anything that is outside of that really narrow scope. So if, for instance, somebody had already scheduled an appointment to have their home painted or have their deck replaced, that's not considered an essential need at this time. And so those things need to be rescheduled. I think beyond that, one thing I do want to add for Marin that is new is that Marin County, specifically on top of the regional health order that was implemented, issued a park closure order that is more stringent than what you'll see in the regional Bay Area order. And really what that comes down to is that our parks and open spaces are closed to motorized access. I'm sure you recall 2 weeks ago, the first weekend of the stay-at-home order, people were itching to get out of their homes, and we had people both from Marin and from elsewhere in the Bay Area congregating at some of our hotspots. And that really created an issue for our local coastal communities that were not prepared for that influx of people. And while I can appreciate people wanting to get fresh air and seeking exercise, more of what we saw was a lot of people just congregating and hanging out.
Sure.
And we don't want to be a downer, but at the same time, this is a public health emergency. And so, these things are put into place for safety and not necessarily to ruin someone's enjoyment. So what our order is again, to close those parks and open spaces to motorized access for individuals in Marin who may be nearby one of those places. They still can certainly, they can walk in, they can ride in on a bicycle. And the other caveat is that individuals with disabilities who do have a valid disabled person's placard or a disabled person marking on the license plate that's valid may have motorized access in, because we want to make sure that everyone has an opportunity to recreate, and we would hate to prevent them from being able to access because they're unable to get in by foot.
All right, Lane Hendricks, Marin County Public Health Officer. We're going to take a quick little break on air, but continue this conversation over on our live streams.
We are in commercial break.
All right, Lane, so let's keep going. That's all really, really great information and clarification. I want to throw a couple more out at you. Somebody wants to know if their mother's gardener can still mow her yard in Marin, and I'm going to guess no.
Right. So this is a tricky one. So landscapers, gardeners, that sort of thing, it's really to focus on those services that are necessary to maintain safety and a healthy operation of a business or a residence. So if it, and what we mean by that is if there's an issue for fire prevention, so defensible space, that sort of thing, or weed abatement. But if we're talking just cosmetic upkeep, that is considered non-essential.
Okay. Michelle Ritz Tavares wants to know, is construction of new homes considered essential services? I assume she means single family and not low income.
1 minute.
Well, that's a great clarification. So if we're talking single family homes, that right now is not considered essential. If it is an affordable housing related project, then that would be allowed to continue.
Okay. All right. Somebody's asking, let's see, it is John asking, is it correct you cannot drive to an open space to walk your dog? You talked about the parking lots, but what about just the act of driving somewhere and then, let's say you park on the street to walk your dog? Is that okay?
That is really frowned upon. So really what we're telling people in Marin is if it requires you to get in your car in terms of an outdoor recreational, like I'm going to go for a walk type of activity, if it requires you to get in your car, it's probably too far. And so you should take your dog on a walk.
Lane, I'm going to put you on hold because we're coming back on air. Let's ask it again live on TV.
You got it.
Okay.
You got it.
3, 2, 1.
And we are back with Public Information Officer for Marin County, Lane Hendricks, answering your questions. Lane, thank you. John has one that I think echoes a lot of people's sentiments, which is it correct you cannot drive to an open space to walk your dog?
That is correct. What we're trying to do is really keep people as close to home as possible, with the exception of completing those most essential activities, such as going to the grocery store or visiting your doctor or picking up your prescription. So what I've been telling people is kind of a rhyme to remember when it comes to exercise or going outdoors. If it requires you to get in your car, it's probably too far. And so we're looking for people to seek those fresh air opportunities close to home, taking your dog for a walk around your neighborhood or something like that. So I realize, again, this is a real challenge for people. We're blessed in the Bay Area to have great open space, but now is the time to stay home for public health and save recreational opportunities for when the shelter-in-place order lifts.
Okay, now I'm going to ask Sheila Jackson Smith's question because I think it is a good one, even though it's almost a little philosophical here, but stay with me, Lane. She wants to know why we are sheltering in place while Southern California is out at a farmer's market and doing what they want. We're doing this for nothing if everyone doesn't do their fair share. So I guess maybe you can address that from the perspective of coordination and getting to kind of a critical mass in terms of people needing to do the same things to try to achieve a goal.
Well, I can't speak for individuals that choose to ignore the order, but I can say that our shelter-in-place order here in the Bay Area is in line with that of the governor's similar order, which came into play just a couple of days after the Bay Area pulled that trigger. So, we hope we're seeing a lot of activity with our southern counterparts in different counties in terms of tightening up their restrictions and even implementing additional procedures to try to mitigate the spread of COVID-19. At this point, I want to applaud the Bay Area for being so forward thinking in a lot of ways. And I think the Bay Area is leading the way in many respects for the state in implementing really strict protocols. So to that, I would say, let's continue that effort. Let's show our neighbors to the south what needs to be done so we as a state can move past this.
All right, Lane Hendricks, I'm afraid we're just about out of time, but I would love to have this conversation and continuing with you another time, because I know, a lot of us are very confused because the orders are changing quickly, conditions changing quickly. So keep us posted and let's keep the conversation going.
In fact, anytime.
You know what? We can keep talking during commercial break, so don't hang up yet. The conversation continues on our live streams, but on TV, we do need to take a super quick break. We'll be back with Dr. Alok Patel talking about the difference between coronavirus and other illnesses.
And we're in the break.
All right. We got 2 more minutes, so let's go. Melanie is asking, what about those of us who have horses that need care? Now, I know if we have to take care of a loved one, we can leave the house and we can drive there, we can do all that. But what if it's a horse?
So in the order, it did not overlook the Bay Area's love of animals. And so in there, it does say that essential activities can be for the health and well-being of not only your household, but also that includes animals. So for small animal lovers, that would be going to take your cat or dog to the vet if need be. And for those that do have a horse or a large animal that's not at a boarding facility where that care can be provided, and you need to go out there, you're that sole care provider, then most definitely you can make that trip in order to fulfill that need.
Okay, Janet wants to know, are landlords able to evict tenants at this time? I think not, right?
That is correct. In the state of California, put in some things in place, and specifically for Marin, the Board of Supervisors and all the cities and towns have adopted an eviction moratorium, both for those that are residential renters as well as commercial renters. Mm-hmm. So there's a lot of information about that at marincounty.org as well as marinhhs.org/coronavirus. So if anyone listening or watching rather is in that position, that's a great resource for them.
All right, Lane, I seriously have about 10 seconds, but I want to ask you, are we flattening the curve here in the Bay Area?
We're at a good start, but we're not done. So we need to keep doing what we can to stop the spread.
Okay. Lane Hendricks, Marin County Public Health Information Officer, thank you so much. We'll check back with you in a few days. Take care. Welcome back. We are now able to bring you even more content now that we have this new platform at 3 o'clock every day. That means we get more from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts. Every day, he's going to talk directly to you in a segment we're calling Doctor's Note.
And today's COVID-19 Doctor's Note is all about trying to tell the difference between allergies, common cold, flu, or coronavirus, if you even can. Right now, everyone with a cough or sniffle is worried they have COVID-19. But it's tricky because symptoms are general and can overlap with a lot of other conditions. According to the CDC, COVID-19 usually presents with a fever, dry cough, and shortness of breath. A lot of people with COVID-19 are also reporting body aches and a loss of smell or taste. Now, these are also symptoms you can have with the flu. Early reports suggest shortness of breath and a loss of smell may be more common with COVID-19, but it's too early to make a general rule, so you have to put your symptoms into context. Ask yourself about your recent exposures or travel history. That could change everything. Now, if you have itchy eyes, stuffy nose, and you're sneezing, it could be a common cold or allergies. And if you already have seasonal allergies, like I do, that's a huge hint. Now, at the end of the day, remember, every person is different, and symptoms may vary. If you're sick at all, it's the safest if you just assume you have COVID-19 and follow the same guidelines. And if your symptoms are really worsening, it's best to seek medical care as soon as you can.
All right, all good advice from our Dr. Alok Patel. Take those precautions and we can all help each other stay healthy. Thank you so much for joining us on this new experimental interactive show. Our expert answered a lot of your questions, of course, seconds after you asked them on our live stream. So thank you so much for taking part. Dr. Patel will be here all half hour tomorrow at this time to answer as many of your questions as possible. So make sure you are watching. We'll be back here and online at 3 o'clock tomorrow.
And we're out.
All right, Eric, we survived another one. Yep. Oh, yeah, thanks. She was actually pretty good. I was very bummed about that crappy signal, but whatever. It just killed the whole conversation.